and I hope I'm audible. I'm sorry today mic is not there. And today we are going to have a very nice interesting topic about obesity and early puberty, PCOS, infertility. We see a lot of females who come with a lot of issues with menstrual irregularities. Almost one in every 3 females I see with PCOS and infertility issues. So as we are discussing every time that obesity prevalence is increasing in our country, so we are just trying to figure it out whether there is relation of obesity with all these problems and how to solve that. So we have the expertise here, Dr. Amudha Hari, my very good friend. Thank you so much for joining us for today's program, and I'm sure it's going to be very interesting. We have designed a good set of questions. Like I really sometimes I feel that first of all we can start with puberty issues like early puberty, early menarche. We see a lot of young girls coming with early puberty. So is there any relation with obesity or increased BMI? Like we are seeing a lot of childhood obesity on an increase. So is there any relation with childhood obesity and early puberty?
Thanks for having me, Neha. It's a pleasure to talk along with her. Okay, and there is a direct link between obesity and early puberty. Nowadays, the way the children eat, their lifestyle, their stress levels, you must be laughing, but still their stress levels, and also the way they eat, a lot of junk food, saturated fats, obesity leading to very early menarche. That is definitely an increase today among the children. So obesity in children has to be immediately worked on, and their food habits, there's how they can be de-stressed, all this needs to be looked at.
I think it's no physical activities for them. So previous era, like I still remember, like till 10th, there was no focus on education, and all the time we were outside on the grounds playing. So I do not see that now, and as you told, the stress levels, that's very important, because from 8th, 9th, parents want children to take up, like whether they want to do medicine or engineering, and accordingly they have to start working hard. Competition is increasing, I agree. So a lot of factors play a role, and I feel high time we stress on more of physical activities rather than the video games, and they keep on playing games on the phone. So I think that should be avoided, and less of processed food and fatty food, as she told. We can try to give them more of home cooked food. That's very important.
They do play games, but on the computer. So it is all the time either between studies, which is also online these days, and games, which is online these days. They are never getting out, and they just go eat what they like to eat, and back to their computers. It is really not a good sign.
So friends, one lesson, okay, for all the young mothers here, please make your children, go out, have some more physical activities, encourage them to eat home cooked healthy food, not too much of processed food, and I think that will be okay as far as the other few environmental factors are not in our control. Previously, like if you see 100 years back, the puberty age was 14, 15, and now it's slowly coming down. So certain factors are not in our hands, but I think all these things are definitely in our hands, and we can do something. So my second most important question, like I see them on a daily basis. So I want to, like we keep on telling people, lose weight, your periods will become normal, but I understand it's not that easy as well. So I want you to tell the audience what is the relation between obesity and PCOS. Like first you can tell them what is PCOS.
Oh, this is good, because PCOS is either over-understood or under-understood. Because PCOS is not like a fever where you get the problem, we go to the doctor, you take a treatment, and it's done. PCOS is a complex set of symptoms where, because of the hormonal imbalance, she has a set of issues. It can be mild to moderate to severe. So not everyone needs the same type of treatment, and it is not a you cannot classify it as one single disease. It's a syndrome where there are multiple issues, and the girl have to understand PCOS. Let me just share a small. I just had one girl who had suddenly had amenorrhea where she has not mensurated for more than 4 months. So I just, as a routine, we do an ultrasound these days. So we gave an ultrasound, and the next day I had 3 surgeries. We were operating. The girl was continuously on my mobile. I was really thinking they had picked up some cancer or something, and that she is really in a bad shape. So it was so bad that I asked her to come to the theatre pre-op, because she was literally, you could make her out, she was crying, her face was bloated. She just said, "Madam, I have PCOS." I said, "So what?" She said, "No, madam, I'm not going to have a child. I don't think will I be able to marry. I just googled everything about PCOS." See, this is where they go wrong. Sometimes when you go through certain things, information, without an expertise to discriminate the information, you just pick up negative things fast, and you tend to unnecessarily be in fear or worries, which is really bad. So PCOS sometimes doesn't even require treatment, as if it is asymptomatic and mild and doesn't have a hormonal imbalance too much to it, which is a very mild PCOS, then she might not even require a treatment. Or this could be a girl who is highly obese, hirsute, with a severe hormonal imbalance. Then she might require a treatment which is lifelong. So as long as you have an ultrasound report, please don't worry. Go to your gynecologist, understand where you stand, please investigate further, understand, and then start worrying. Because everyone nowadays are saying, "Madam, I have PCOS, will I conceive, can I marry?" Because so many subfertilities are attached with it. It is not so. First you need to evaluate where you stand, where you are, because PCOS is a complex. Like anyone with PCOS can have obesity, acne, irregular periods, and it's a group of symptoms like this. You might not even have anything, but your ultrasound report might say you have PCOS. So it is mandatory once you have an ultrasound report that says PCOS. PCOS is nothing, it's not like a major ovarian problem. It is just an enlarged ovary with lot of multiple follicles which are cystic. They even say that is as if the ovary has worn a necklace. All the periphery of the ovary starts having multiple small bubbles which are follicles. So this is just PCOS. It can be grouped into 4 things which we will talk subsequently, but definitely the message here is don't worry.
So they should not panic, for PCOS, because we see nowadays a lot of people with PCOS. And do you feel that obesity is a major factor? Like obesity leads to PCOS and it becomes a cycle. PCOS leads to obesity as well.
It is
a
like
cycle.
Chicken is first or egg is first. But one thing is, whenever you have PCOS, most of the time you are very obese, and the obesity leads to more PCOS. The only point where you can really act on is your obesity. So I always keep saying, whenever you need to work on your PCOS, please work on your body weight, please work on obesity, so that will break your PCOS cycle.
So it's very important message for people that we keep on telling, because we are I'm a pediatric surgeon. When I tell people that lose weight and your PCOS will go, they still think that when it comes from a gynecologist, they feel that okay, now really I need to lose weight. So I feel that when you lose weight, your PCOS will be almost resolved and your periods will become regular. And weight plays a very important role. See what happens when you are obese, all the fatty tissues, they will secrete lot of estrogen. So that will lead to hormonal imbalance, it will lead to anovulation also, and that is where you will have so much of menstrual irregularities. In future, you will end up with infertility also. Now, important thing, like nowadays, we see so much of PCOS. I would like to tell people that please start doing some physical activities. There was 2 days back somebody was asking me whether exercise in the morning is good or exercise in the evening is good for weight loss. So generally it is advisable that you work out empty stomach. So it is in the morning, it is always little better because it will step up your metabolism. It will help you to lose weight faster rather than working out in the evenings. So start working out, especially the females out there. You should at least do some fast activity for at least 45 minutes, 1 hour. That will be my recommendation. If you are into yoga, you can get into yoga and things like that, and please show it to your gynecologist. Start finding out the root cause for PCOS and start treating it. It's treatable.
To add on to what Dr. Neha said, see, exercise per se, it's easier and better done in the morning. But if you are someone who can't do it in the morning, please just
Please
don't
do it.
And one more thing,
That's very true.
one more thing is try to do the exercise at the same time. Because people say, women particularly say, Madam, I'm working from morning to middle of the night. What are you trying to ask me to work out again? It is not like that. The brain has to understand this is an exercise and it has to be, like she said, fast aerobic, so that it gives you the endorphins which is necessary. Whenever you do a good exercise, the body secret. You must be knowing, once you had really done a proper exercise, you suddenly feel a little better. You want to smile a little more. So the brain gives you what is called as endorphins, and they are very important for all the good effects the exercise brings. So whenever you do it at the erratic time or you really don't keep up, please do the exercise same time, whether it is evening or morning. Morning is of course preferable.
So now the most sorted people, whether any relation with obesity and infertility. And I want you to tell us how obesity affects male fertility also. Whenever we see a wife is obese, husband is obese as well, but they do not check their BMI, so they don't know, and always the culprit is the female. That our society is like that, so I'm just trying to open up this topic openly. Every time I see females, they will just keep on telling that no, female only has to lose weight and infertility is only because of the female. So I want you to little tell us about female infertility as well, but then the relation of obesity with the male fertility, because definitely that is also related.
See, obesity in anyone, whether it is male or female, is definitely linked to fertility issues. See, whenever a female or a male, first let us go to very basics, are very obese, even physical intimacy becomes a very difficult thing. They are, because of their hormone imbalance, they feel very dull. Most of the time they are, most of the very obese women or men, they are little depressed, because whatever you try to say, they are somewhere in their mind, they feel they are not enough, and there is a question of insecurity about their physical appearance. So this also leads to, see, we are just not the body, we are mind, body, and definitely there is a strong link between your emotions, the way you think, and your physical well-being. So whenever you are obese, naturally women more, and men definitely, if they might not show it, also true, that they have this hormonal imbalance, and these needs to be definitely evaluated properly, treated, and obesity, underweight or overweight more so, definitely causes you fertility issues. So whenever we say pre-counseling sometime for conception, if they are on the obese side, we definitely do the hormonal assay and then give them, please work on your weight and lose this amount of weight, so that because let us say a woman is already obese and she gets pregnant, she's going to add on another 15 kgs. So that's going to be really troublesome for her, for the baby, the delivery, everything. So it is mandatory, if you're obese, that you work on your weight and plan your family little bit.
I think that's a very important message. You should try to lose your weight and then try to conceive, rather than just trying hard only for conceiving, and then you will once you fail, even once you fail in the IVF cycles, you get into depression, and then you really feel that, oh, I'm not getting the child. So I feel it's very important you start losing weight and then you plan your child, plan the pregnancy. So that's very important. And relation between do you feel that obesity leads to less spermatogenesis and low sperm count?
Yes, definitely it is linked to all the issues which is connected to fertility. That's what I said. Basic, even physical intimacy is very low in people who are obese, particularly men if they are very obese. And second is there is some hormonal imbalance and some eating mismatched eating problems where their food is either junk or they are used to eating bad food all the time. And something like this is definitely not going to be very active, and it is not going to be sexually very active. And there is, whenever you see a hormone assay and you do a semen analysis, there is some problem that is linked to obesity. So, and one more very important thing, when such obese people come and they really follow your orders and they really take up your advice and they lose weight, they even conceive naturally much faster. They don't even need a fertility treatment. So I think first you need to work on yourself, particularly if you're obese. Please work on your weight and check all your hormone assay. Take a good gynec or a doctor's reference and then go about it. Just spend some time on that before you think of your fertility issues.
So I think whether it's a male or a female going through issues of fertility, I feel both of them has to lose weight, and definitely losing weight is going to help both of them. So today's I just tell one small gist of today's program. It was very interesting. Early puberty, again, because less physical activity and rise in childhood obesity, all those things also play. Okay, one important question I want to ask you. A lot of people used to tell that people who eat meat and milk products, the meat, like we are pure vegetarians, but still I suppose that chicken and whatever they inject with a lot of hormones. So they are all artificial growth hormones they inject. Does that really affect the hair?
Yes,
or it's just a myth?
No, it is not a myth. See, any food that is going to be processed, high sodium content, injected with genetic modification, that is the reason. See, when we are practicing just about 15 years back, very less PCOS we were seeing, very less fertility issues we were seeing. If we get about 10 patients, one patient will have fertility, or even 100 patients, you will have few patients who have fertility issues. But now it has become almost, if you are going to see 10 patients, 5 of them have fertility issue. So definitely our food habit, our lifestyle, our stress has a direct impact on not only our weight, our fertility, the way we look upon everything. So this is not a myth. So how do we go about it? See, this is one issue where you don't have much say in it. Try to eat a very balanced diet. If you like chicken, have it, but have it in a medium quantity. Try to have a lot of fresh fruits, vegetables, soap, nuts. Have a variety of food so that you get all the nutrition and in a very balanced way. Have what your heart's content, have what your mind also likes, what you feel satiated. But just don't go on binging on bad food all the time.
Yeah, so it's very important that you take everything but in a limited quantity. And at least mutton to some extent, I just tell people who are struggling with the weight just to avoid mutton. Chicken is alright to some extent, fish is alright to some extent, eggs are fine. So try to have a balanced diet as she told. And friends, so we would like to end today's session. And one important announcement I am going to make today. We have started an obesity club. So that's the Anti-Obesity Club. I am going to put it on the Insta page. It is free enrollment for 1 year, and we are just taking a token amount of 1,000 rupees which will go for the journal publication. So what do you get for this 1 year? We are just doing this to spread the awareness among the public. Every week you will get one personalized session with our fitness trainer, and you can come to our Swastya gym and you can utilize the gym. People who are from outstation, they can be in touch with us on the video call, and we will teach you certain exercises our fitness trainer will teach, and you can continue that in the house. So it's a 1-year program, starts from 1st April. Everybody who wants to lose weight this year, please join the club, and I am sure even if you lose in a month, if you lose just 2 kgs, 12 months you are going to lose close to 20 to 24 kgs. Okay, that's going to be quite significant. So we are not here to give you instant weight loss or something. We will be guiding you throughout with different forms of exercises. Every month you will get one journal publication from our Swastya, and it will have all the different kind of articles, like what all you should eat and what are the myths and facts about obesity. All different varieties will be there. And once in a month we are going to do personal meetings as well. So people who are within the station can come and visit us here. People who are from outstation can consult on phone. The whole thing is free, so don't worry about anything. So friends, please join the anti-obesity club, and this year let's do something for obesity. Thank you so much for joining for today's program. Thank you so much.
Yes, thank you.